Hi, I'm Bob Kraus, President of the Veterans National Recovery Center, and our mission today is to describe the problems that migraines... Hi, I'm Bob Kraus, President of the Veterans National Recovery Center, and today we'd like to talk about the absence of migraine specialists within the VA healthcare system. And we have a case right in point here. And it's important because who gets migraines? Well, people with TBI often have migraines. People with post-traumatic stress disorder often have migraines. And the lady that we'll talk to has a special condition that has migraines 24 hours a day without medication. Now, right now when we talk to her, she is medicated. So she may appear normal to you, but without the medication, she's off the charts. Now, who I'm talking to here is Sabrina Waller. Can you say hi, Sabrina?
Hi.
And Sabrina is she's a veteran of the Kosovo conflict. And she is 100% disabled because of her migraines. And the story is that she was on a carrier during the Kosovo conflict. And there were some very low speeds or low-level supersonic flyovers that cause sonic booms, which have the same effect as an implosion or an explosion on the brain. And it actually compressed her pituitary gland, which is, we think, is a major contributing factor to what's going on with her headaches. But Sabrina, can you describe your symptoms to us? And also tell us about your efforts to get this case resolved.
So initially was diagnosed with chronic migraine disease in 2011 after just unexplained episodes of vertigo and just chronic head pain that just wouldn't go away. That was the diagnosis that they decided to give. And months of crying and pleading to say, like, I need more than whatever you're doing for me because nothing seems to be working. They did the CT scan and noticed the partial empty cella. So that's been since 2011, and I've been dealing with just daily debilitating symptoms and having to kind of find relief in whatever avenues I can search for relief.
And so this empty cella, which you're talking about, is actually when the sonic boom happened, the boom comes down on the skull and it refracts down to the center point of the brain, where the pituitary gland is in a little pocket, and that was compressed. That we believe is what caused the problem. There are solutions out there, and in the civilian world, there are migraine specialists to deal with this. But to date, in the city of Chicago, where we're at right now, there is no migraine specialist for veterans. In the entire United States, we have yet to be able to identify a migraine specialist. And we're just as bad for endocrinology, which she needs because of the pituitary gland. Nothing here in the Midwest that we can identify that's not connected with working with diabetics. Well, this is a whole different thing, but it is endocrinology, and there are not the right kind of specialists on. What do you have to say about that? How hard did you search to find these different specialists, Sabrina?
Like I said, it's been since 2011, and a lot of it has been me advocating for my own medical treatment. So it's quite disturbing. It wasn't the welcome home that I expected, and it really hurts, especially since I know the VA is, quote me if I'm wrong, I think I read 50,000 members short staff. It just feels like we consistently find money for war, and we forget about the warriors, and adding like the cost of war when we have medical treatments when we come home.
And that's the point of our video today, that we have untreated veterans. Sabrina is one of many. She does have a special condition, but it is a special condition that she cannot get treatment for inside the VA, and the VA won't pay for help outside the VA. She has had to go out and spend her own money to get medical treatment. Right now we have a person, a doctor, medical doctor, identified in Florida that has some techniques that he has used on special forces troops that have had TBI episodes. And, but the VA won't pay for it. So when you finish viewing this,